Hello, my name is Savannah Rivera, and today I will be presenting to you the Community Assessment of Norwich, Connecticut. So, in this presentation, I will be discussing the community description, so that involves the physical environment, the windshield survey, the interviews that I conducted of health leaders, socioeconomics, and demographics. Next, the methodology, which is a logic model I used in the sources that I got my quantitative and qualitative data from. Next, the community health profile, so how healthy the community is, any health risks I found, the priority health issue, and the risk population, and the relationship of health issues to socio-demographics. I will be discussing the community assets and capabilities of Norwich, Connecticut, as well as the discussion and findings, so results, strengths and limitations of this process, and recommendations that I came up with to solve the primary health issue. So Norwich is a suburban town in New London County. There are about 39,136 people as of 2018. 14.1% live in poverty, which is greater than the New London County. The New London County is where Norwich resides. That's the county that Norwich is a part of. The median house income is $55,391, which is also less than New London County as well as the state of Connecticut. I conducted a windshield survey, so what that is just driving around the community and just making note of what I see. So I noticed there's a mixture of nature areas as well as more urban areas. So nature areas include golf courses and parks, whereas some areas are more filled with apartments, a bunch of stores such as Walmart, Goodwill, fast food places, ShopRite, a bunch of nail salons, Dollar Trees, TJ Maxx, the list goes on. Here's just a couple charts to describe where I got my median income and poverty data from. And here is a chart about demographics. So this compares New London County to Connecticut. Again, Norwich is found within New London County. So as you can see, there are more people within the age group of 0 to 17 than there are people ages 65 and over. Next, we have race and ethnicity. So the Norwich area is primarily white, non-Hispanic, but the next nationality is Hispanic with a percentage of 10.3%. And then after that is Black non-Hispanic with a percentage of 5.3%. So I conducted a few interviews. The first interview was with Laura Curry. She is the Vice President of Patient Care Services at Bacchus. And during this interview, I was also interviewing Lisa Hageman, which is the Regional Director of Preventive Medicine and Community Health. So as I said, I was in the interview with both of them, and they both described Norwich as more urban, low socioeconomic status, diverse, again, Hispanic. There is a Haitian population and some Native Americans. The health issues that they expressed of concern were opioid addiction, heroin, smoking, which are all considered substance abuse, transportation to have access to health care, mental health issues, and access to healthy food. I also had the opportunity to interview the Director of Health at the Uncas Health District. So Norwich, Connecticut is one of the 11 towns that the Uncas Health District oversees. Patrick McCormick is the Director of Public Health at this public health organization, and he expressed concerns about public health transportation, health equity, poverty, behavioral health, tobacco use, vaping, opioid epidemics, and specialty care. So I used the precede proceed model to conduct this assessment of Norwich. But mainly I used the pre-seed part to analyze the community because there wasn't any time to use the proceed step, which includes interventions and evaluations. So I more just used the pre-seed part of this model to just analyze what exactly the Norwich community needs. The qualitative data that I collected was through the Windshield survey and the interview. So again, this is information that's not necessarily numeric or statistics. It's more, what the community looks like, or just needs that the public health leaders have expressed to me. The quantitative data is where the statistics come in. So I heavily relied on the Bacchus Community Needs Assessment. So Bacchus Hospital is a nonprofit hospital, and every 3 years they produce a community needs assessment. So this is where all the charts and the graphs were produced and where I got a lot of information from. I also got some quantitative data from Uncas Health District site, the U.S. Census Bureau, Data Haven, and many more reliable sources. So the community health profile of Norwich. So New London County, Windham County, and the state of Connecticut all presented cardiovascular disease as the second most common cause of death, followed by cancer and then respiratory disease. So Norwich falls within the New London County, but again, Norwich kind of has its own data. The priority health issue that I found from the Bacchus Hospital Community Assessment conducted in 2018 was chronic obstructive pulmonary disorder, which is also known as COPD, and it is a respiratory disease. At-risk population for this priority health issue include people of low socioeconomic status, smokers, and women. Norwich has a higher prevalence of smoking than Windham, Connecticut. The service area of Bacchus has a higher smoking rate than the state of Connecticut and Healthy People 2020's rates. So here is a fabulous chart that I pulled from the community assessment that Bacchus created. It lists all the chronic conditions such as current asthma, arthritis, diabetes, depression, COPD, and cardiovascular disease. So even though cardiovascular disease is the second most common cause of death in New London County, I chose COPD as a priority health issue because it is significantly worse than the state average. So if you take a look right over here, 9.1% of the population in Norwich suffer from COPD, which is significantly worse than the Bacchus service area, which is, Norwich is included in, and the state of Connecticut, which is only 5.5 versus 9.1. And Windham, a neighboring community, is only at 5%. So here are just a couple more charts that I found on the Uncas Health District website about cancer. Here's another one about opioid addiction. And a great one about smoking habits of adults in the Uncas Health District community, which Norwich falls in, which you can see is higher than Connecticut. So good news is that Norwich has a lot of community assets and capabilities, including Bacchus Hospital. There's a fabulous hospital right in the middle of the community, as well as the Uncas Health District. There's also the United Community of Family Health Services, also known as UCFS, which deals with a lot of populations that may not have proper insurance, or deals with populations that don't have insurance at all. They partner up with Bacchus and Uncas Health District a lot. There are several schools from pre-K all the way to 2 high schools and a community college, and there are many churches. So as a result, COPD is a primary health issue due to several social determinants. Again, socioeconomic status plays a huge factor in this. People of lower socioeconomic status have a higher prevalence of smoking due to mental health issues, stress, anxiety, and environmental factors. Some strengths of this assessment was that I had access to the community. I'm only about 15 minutes away, so I was able to drive around the town and note um, physical aspects of the community myself in the windshield survey. I was able to physically meet local health leaders to interview them and get their points of view on the issues. And Bacchus Hospital was kind enough to send me the most up-to-date community assessment, so I could pull statistics from there. Some limitations could be interviewer bias. So, Bacchus Hospital and the Uncas Health District, they deal with so many more towns other than Norwich. So some of the needs of other towns might have, diffused into Norwich as well. It might be hard for them to distinguish the needs of Norwich versus neighboring towns. The community assessment was also 2 years old, so obviously things are constantly changing. It wasn't the most up-to-date information. And I just wanted to present 3 realistic and actionable recommendations to address COPD. So first, creating a smoking cessation program through Bacchus and Uncas Health District. Second, smoking education seminars in schools systems as a preventative attempt. Education is a form of preventative medicine. There's a lot of youth in the community, so if we could, incorporate a health seminar in the health class about smoking and the consequences of it, I think that'd be very successful. And lastly, creating a more smoke-free community by enforcing policies similar to Bacchus Hospital. So I used to work at Bacchus Hospital, and they have a smoke-free campus. So, there's penalties if somebody was found smoking in the facility. So I think Bacchus and Uncas Health District can work together to create smoke-free policies around the community. Thank you very much.